So my name is Dan Wright, and I'm here today to talk about how Immigration, Refugees, and Citizenship Canada measures the settlement outcomes of newcomers to Canada. And this will include an overview of what we try to measure and some of our key data sources. And then I'll also talk about some of our current challenges, sort of echoing one of our discussions this morning, and how we're working to address them to help improve our knowledge base. So first, a quick overview of the settlement program. And one thing that stands out for me is the sheer scale of the program. In terms of its resources, there's about $800 million being invested and that's outside of Quebec. The number of lives that it touches, nearly 500,000 people in a single year. And the comprehensiveness of the services that are offered, and then the number of partnerships that are involved with over 500 service provider organizations. And so the first service type I want to draw your attention to quickly, it used to just be called needs assessment and referrals. And that involves determining what services our clients need and then referring them to providers of these services. However, one thing that we heard back from our clients was that they want to be in a position to give back to Canada as early as possible, and by documenting their assets, their skills, their life experiences, and their abilities, this might help them do this as part of their settlement and integration into Canada. And so the service is funded by RCC and provided more directly by SPOs. Sorry, for those in the room, I'll try not to do the alphabet soup, but I just caught myself out. That's, again, settlement provider organizations. So they're intended to help newcomers achieve certain specific outcomes, and we'll see these on the next slide. Yeah, excellent. So I'm not going to go through all the text here. You can read it at your leisure by downloading it. But these outcomes for the settlement program may be familiar to several people in the room. And through the receipt of the direct and indirect services that are funded by IRCC, we hope that newcomers will achieve the outcomes that we see here. And you'll see that there is a mixture of social and economic outcomes, which echoes Cedric Deschardins was presenting this morning in terms of what we can show in terms of those sets of outcomes. And over time, newcomers should ideally progress from attaining the more immediate outcomes to the intermediate ones, and then culminating in full and successful settlement and integration. And very, very roughly speaking, the sense is that immediate outcomes should be achievable in the first year or so within landing and starting to receive services. Intermediate outcomes would be more over the first 5-year period, again, very roughly, and then the ultimate outcome will take at least 5 years. But it's worth noting that these are very notional timelines, and they don't have any bearing on clients' eligibility to receive services. But to be sure that we're funding the right services, RCC is very interested in determining to what extent newcomers are achieving these outcomes and the connection between the services that are provided by or through IRCC and the achievement of outcomes by our clients. So in terms of where we get our information, it's more than just a blank sheet of paper. We'll get to it. So we have access to a variety of data sources. And the first one that we'll mention will be familiar to several people involved in program delivery. That's the ICARE, which is a fun acronym for Immigration Contribution Agreement Reporting Environment, but sounds a lot friendlier as an acronym. And so this one contains a wealth of information on the settlement clients themselves and their service usage, which contributes directly to reporting against program outputs and supports outcome measurement later on. IRCC's Research and Evaluation Division has also started delivering annual surveys that provide important insights on recent immigrants' needs and their social outcomes, including things like sense of belonging and community engagement, as well as their knowledge of and utilization of services available to them. And so this will give us more information on the degree to which newcomer gains can be attributed to IRCC service provision. And so the survey that was delivered in 2017 was administered to those who'd landed in the years 2011, 2013, 2015, and 2017. And then the next round of the survey will be administered to those who land in even-numbered years. And just a quick note that one thing that's nifty about this is that we reached out to everyone who had landed in those years, not just those who had received our services. So information on what non-clients are experiencing is a very useful piece of comparative information here. So next up, more on the acronyms. Here we take the first acronym we saw, and we connect that to the Longitudinal Immigration Database. I know it doesn't fit the letters, which essentially lets us connect settlement service usage to tax records. And this gives us information of the impact of the settlement program on newcomers' economic outcomes, things like earnings, social assistance rates, and fiscal contributions, and gives us something that might help us with evaluating value for money. And so the fourth type of information I'll mention here, this isn't everything, but it's what we'll cover for now, are the larger surveys delivered by Statistics Canada. And they help us measure, in particular the ones I'm thinking of, they help us measure social outcomes of newcomers and compare them against those who were born in Canada. So again, a useful comparison to be able to make. And as an example, and I think Cedric mentioned this in passing, the Canadian Community Health Survey has also been linked to that IMDb, the tax filer database, which will give us another window into health, social, and economic outcomes for newcomers. So these data sources are helpful in measuring outcome achievement, but attributing these gains specifically to services funded by IRCC is a bit of a challenge, as we're going to see coming up. So the first issue for us, and this was raised in an earlier presentation, is that using randomized control groups would be ideal for measuring and attributing gains to specific interventions. However, we can't purposefully put clients on wait lists or refuse them service in order to assess programming impacts. In addition to the services that are provided by IRCC, or more likely funded by them, there are other entities working to provide services to newcomers. This can be other provincial and territorial governments, other federal government departments, private corporations, more local groups. And so it's difficult for us to know when this occurs and how much of an impact each service has on client outcomes. And also some of our outcomes, one thing we care about is knowledge of life in Canada. That can be acquired through osmosis, essentially, to a certain degree. So the next one is that although surveys are an excellent source of information on client outcomes, they also have some inherent biases in them, in that they only collect data from those who respond to the survey, and they're often reliant on the respondent's own assessment of their gains. So it's not quite as precise as we might ultimately desire. And although RCC provides some guidance on reporting requirements, it's how these requirements are understood can differ, and this can affect the data entry, which can then affect the reliability of the data in our systems or how we are able to interpret it. And SPOs have also noted the administrative burden of all these reporting requirements. So we're in a process where we're trying to improve on this by reducing the requirements where we can, so we focus on the most important information. And another angle of this is we're also working to improve the amount of information that we provide back to settlement provider organizations. And one of the other challenges is that clients may be differently motivated to participate in settlement programming, which could impact not only their own outcomes, but also our sense of how effective the service they receive was. So these challenges, and probably many others, limit our ability to assess the benefits resulting from IRCC services specifically, but we're working on some ways to improve the attribution angle. And to that end, or in support of that end, Immigration, Refugees, and Citizenship Canada has created a new outcomes analysis unit, and the role of this unit is to increase the department's understanding of settlement outcomes, including the attribution question, which then will support later analyses of the value for money, in a sense, of the services that we fund. And so some of the other work that's happening is that we're in discussions with the provinces about the possibility of sharing data with them, possibly linking provincial settlement service records with our own survey results or something like that. And the benefit of this kind of linkage is that it would let us identify 4 populations: those who received services just from IRCC, those who got services just from the province, those who got services from both, and those who got services from none. And this, being able to do this kind of analysis would definitely help with attributing the relative impact of each of them. Another line of information is that the evaluation division here at IRCC is piloting a settlement provider organization effective study. And this is being developed to better understand what success factors are at play at the level of individual SPOs, and doing this by collecting operational information and results information. And this has the potential to feed into policy and program directions and possibly the general direction of investments. When this is planned to be rolled out towards the end of 2019, and this will be another evidence basis upon which we can assess the effectiveness of settlement programming. Another line of evidence that we can try to make use of is by studying pilots. You may be aware that we have a number of pilot programs on the go. Some of the ones that are in circulation a lot at the moment are things like the Visible Minority Newcomer Women Pilot and the Service Delivery Improvement Fund projects. And these could be a valuable source of information because they already include an experimentation component. They're trying to identify the most effective interventions with particular client groups. Also, some of these projects would have been funded because they specifically seek to increase the efficiency or the effectiveness of using a particular kind of intervention. And Babe, I believe your organization is doing some work in relation to this pilot. Do you want to speak about that either now or as part of the later discussion?
Maybe later on.
Okay. Just bear in mind, she knows more about this more directly, so worth asking. Our unit is also looking into doing a case study methodology, studying specific interventions and treating them as cases. And then the challenge in doing this kind of work is accounting for all the contextual factors that are at play in here, or mediating factors, community characteristics, whether there's a local immigration partnership, all these other, tangible but not necessarily immediately apparent factors that can influence what the results that we get. And although this isn't purely ideal, it may be possible to treat clients who are on wait lists for a particular kind of service as a control group for that kind of service, because compared to those who receive it, they've been assessed as having the same kind of needs. This would provide a quasi-experimental design, which may bear some fruit. And so one direction all this work may end up is going to go is heading into an annual report on settlement outcomes, which is the main deliverable of this outcomes analysis unit, which I should perhaps note that I'm a member of. And so our intent is to publish the first edition of the report in December 2019. And the first edition will focus on domestic service delivery. So it won't include the pre-arrival services or the resettlement assistance program as what we're looking at. That'll come in time, we hope. And our first report is also going to leverage a lot of existing information because we know there's a lot out there. Future reports are going to build on this basis and work to cover additional ground. And so we'll be looking at each of the direct service components, employment-related services, information and orientation, language training, support services, and what we can tell about both the immediate and intermediate outcomes. And where possible, we're going to be looking to make comparisons between settlement program clients, newcomer non-clients, and the Canadian-born. And there were some very useful comments made in an earlier session about some things to keep in mind when comparing to the Canadian-born, and I hope to bring that back to the group and have us account for that. And also, where possible, we're going to be breaking out results by such things as immigration category and family status, and which settlement program component they received. And because we're fairly realistic that this is kind of a longer-term project, and there's quite a bit of virtue and transparency, there's also going to be a section on current data gaps and discussion of how we're working to increase our ability to analyze attribution and value for money over time. And as noted earlier, the reports is going to be an iterative building of knowledge base. And this, I think, takes me to the end of the presentation. Thank you.